There are a bunch of different ways that we can do slapping or striking. Preferably you're using a table that's more appropriately heighted.
Sorry, we're short.
That's okay. I'll get some horse stance practice in. A lot of the techniques for percussion or tapotement are going to be very similar across styles of massage. So some of them are simple things like cupped hands are a very popular one for tapotement. And that one works really well. It's not super palmy, you get that little air cushion under your hand as you do it. So that's a useful one. The Chinese often do that one if they're trying to break mucus free in people in the field of the lung. They'll also do it in the upper chest a lot of times. I like to use the bottom of my hand, little hammer fists. So just a loose hand, I've got my knuckles open or my fingers open, and just gently bounce them. Just got to make sure you're not drumming a beat, or your patient may notice. Is that the drum solo from Turn the Page?
Oh, I hit the harder on that.
You can, but I'm pretty gentle usually.
I hit the very loud.
The clacker, as I call it, which is the one I'm really terrible at, where you use the edge of the hand and your fingers supposed to clack together. My hands don't like that one. It doesn't clack much, but that's another common one. Some that are less common in Tui Na are things like fingertips, either loose and open, or they bring them together into a little point if they're working more specific areas. So it's another common sort of tapotement, slapping and striking. Yep. Easy peasy. She's like, I got screwed. I'm the demo on the slapping and the striking. Doesn't feel bad. It's a chocolate chip cookie, right? The next one on our list here, the flick poking or strumming, is just cross fiber manipulation or cross fiber strumming, whatever you like to call it. You can do this with a bunch of parts of the hand and on a bunch of parts of the body. Common places that we use this are for the erector spinae. The thing that makes cross fiber effective, or that it stands it apart from other techniques, is that the pressure is applied on one side of the bundle of fibers and kept on while you push across to the other side. So you're not loosening or lightening that pressure as you move across. Fingertips are common. I actually think that's probably my second least favorite. The thumb is my least favorite. I try not to strum with my thumb because it's really hard on the saddle joint, the carpometacarpal joints in your hand. And there's other tools, but it is a common one. My favorite are pip joints. So I'll place the pip joints on one side or the other of that bundle of muscle, apply some pressure, and run them back and forth across. It can be intense, so modulate your pressure. Scream before you kick, Lauren. Not too bad? Okay. The pip joints, one thing I actually like about them is that I can use all 8 of them placed in a row on the back. So I just hold one of my thumbs with my other hand loosely, and I want to try to get where my wrists are straight. So I'm not cocking my wrist into flexion or extension. My wrists are basically neutral. I can apply gentle pressure down and strum back and forth. Just like that. So that's flick poking. You will see strumming across taunt bands in every part of the body. We'll talk about it again in the leg tomorrow and in the arm. I do a ton of it here across the levator scapula in the neck. Anytime you're just holding that pressure and running back and forth, that's flick poking. Of course, in China, in the Tui Na clinic, they would be doing that with as heavy a pressure as they can push and rocking back and forth pretty quickly. I tend to take the approach that less is more, and unless I really need to, I don't get that aggressive. But, your clients and your practice, you do whatever you feel like. So that's strumming. A last one that's on the list, I think it's the last one for right now, yep. One finger meditation, rather. We did flick poking already. One finger meditation is kind of a combination of pressing or penetrating, depending on how deep you're pushing, and jostling. And traditionally, you're going to use your thumb for it, but you're not going to move your thumb to make the motion happen. So I'm going to pronate my wrist, I'm going to apply pressure on the spot I want to treat, and then I'm going to be moving my arm so that my hand waggles back and forth. And my thumb is supported on the proximal phalange, but it's allowed to bend and relax and straighten back and forth at that IP joint. So if I'm working that levator scapula spot, I'm going to come up here and apply that pressure, and then I'm going to waggle the hand back and forth. Just like that. It's great for working sticky trigger points that nothing else is relaxing. If you do any sort of acupressure or distal work, it's great for spot treatment of an acupressure point if you're trying to help somebody out with a specific issue or pain. But trigger points is another real common use for it. The trick is to relax the thumb and actually get it. It almost has kind of a snappy quality, but you're not hyperextending it or locking it. And it should be as relaxed as humanly possible.
It's kind of like it's wagging.
Yes, yeah, very much, but under pressure.
Yeah. Yeah, all wagging. So the nail is pressing, right?
The nail is pressing in. I'm pushing straight in with the tip, and I'm going like this. I don't know if you can see that. It's doing this, but I'm not using my thumb to do that. I'm supporting the base of it, and my hand moving causes my IP joint there to bend and straighten.
I can feel my nail. That's all right.
Yeah, you will a little bit. It's the first needle before they had needles. They used their fingertip as the stimulator.
Oh, your teeth.
Only in Hollywood. Only in Hollywood. That one you can apply anywhere. Just check in with your patient. Sometimes it can be pretty intense. And pay attention to your hand. If it's hurting your hand or your thumb, we need to adjust something, or it may not be the technique for you.